What high blood pressure? High blood pressure is a common condition in which the long-term force of the blood against your artery wall is high enough that it may eventually cause health problems such as heart disease. Blood pressure is determined by the amount of the blood your heart pump and amount of blood flow in your arteries. The more blood your heart pumps and the narrow your arteries, the higher your blood pressure will be. You can have high blood pressure, hypertension for years without any symptom. Even without symptom damage, the blood vessel and your heart continue and can be detected. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. High blood pressure generally develops over many years and it affects nearly everyone eventually. Fortunately, high blood pressure can be easily detected, and once you know have high blood pressure, you can work with your doctor to control it. What are the symptoms? Most people with high blood pressure have no sign and symptom. Even if blood pressure reading reach dangerously high level, a few people with high blood pressure may have headache, shortness of breath, or nosebleed, but these signs and symptoms aren't specific and usually don't occur until the high blood pressure has reached a severe or life-threatening stage. When to see the doctor? You would like to visit the doctor as soon as possible if you see such kind of symptoms. What are the causes? There are two types of high blood pressure: primary hypertension and secondary hypertension. For most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure, called primary hypertension, tend to develop gradually over many years. Secondary hypertension. Some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tend to appear suddenly and causes the high blood pressure than does primary hypertension. Various conditions and medication can lead to secondary hypertension, including obstructive sleep apnea, kidney problems, adrenal gland tumors, thyroid problems, certain defect you are born with in blood vessel, certain medications such as birth control pills, cold remedies, decongestant, over-the-counter pain relievers, and some prescription drugs, illegal drugs such as cocaine and amphetamine. What are the risk factors? High blood pressure has many risk factors, including age. The risk of high blood pressure as you age until about 64 years. High blood pressure is more common in men. Women are more likely to develop high blood pressure after the age of 65. Race. High blood pressure is particularly common among people of African heritage, often developing at an earlier age than it does in white. Serious complications such as stroke, heart attack, and kidney failure are also more complication in a people of African heritage. Family history. High blood pressure tend to run in families. Being overweight or obese. The more you wait, the more blood you need to supply oxygen and nutrient to your tissue. As the volume of blood circulated throughout the blood vessel increases, so does the pressure on your arteries walls. Not being physically active. People who are inactive tend to have higher heart rates. Using tobacco. Not only does smoking or chewing tobacco immediately raise your blood pressure temporarily, but the chemical in tobacco can damage the lining of your arteries. Too much salt. Too much salt in your diet can cause your body to retain fluid, which increases the blood pressure, which is the main cause of the hypertension. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cell. If you don't get enough potassium in your diet or retain enough potassium, you may accumulate too much sodium in your blood. Drinking too much alcohol. Over the time, drinking too much alcohol can damage your heart. Having more than one drink a day per woman and more than two drinks a day per man may affect your blood pressure. If you drink alcohol, do so in moderation. Stress. High level of stress can lead to temporary increase in blood pressure. If you try to relax by eating more, using tobacco or drinking alcohol, you may only increase option problem with high blood pressure. Certain chronic condition also may increase your risk of high blood pressure, such as kidney disease, diabetes, and sleep apnea. What are the complications of high blood pressure? The excessive pressure on your arteries wall caused by high blood pressure can damage your blood vessel as well as organ in your body. Higher your blood pressure, The longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including heart attack or stroke. High blood pressure can cause hardening and thickening of the arteries, which is known as atherosclerosis, which can lead to a heart attack, stroke, or other complication. Aneurysm. Increased blood pressure can cause your blood vessel to weaken and bulge, forming an aneurysm. Heart failure. To pump blood against a higher pressure in your vessel, the heart has to work harder. This causes the wall of the heart pumping chamber to thicken, weaken, and narrow blood vessel in your kidney. This can prevent these organs from functioning normally. Ticked, narrowed, or torn blood vessel in the eyes. This can result in the vision loss. Metabolic syndrome. This syndrome is cluster of disorder of your body metabolism, including increased waist circumference, high triglyceride, low density lipoprotein, cholesterol, the good cholesterol, high blood pressure, and high level insulin. These conditions may more likely to develop diabetes, heart attack, and stroke. Trouble with memory or understanding. Uncontrolled high blood pressure may also affect your ability to think, remember, and learn. Trouble with memory or understanding concept is more common in people with high blood pressure. Dementia. Narrowed or blocked artery can limit blood flow to the brain, leading to a certain type of dementia, which is known as vascular dementia. A stroke that interrupts the blood flow to the brain can also cause vascular dementia.